And both of them have been doing these group experiences. One of
Yes.
them, I think had with 1,000 men over a 14 or 15-hour period. And they're doing it for these sensational reasons. But I'm watching the media just attack these women. That was what stood out to me as I started wrestling with these issues as a psychologist. Is interest in groups inherently unhealthy? Is it a sign of psychological disturbance? Well, if it is, then why is interest in groups one of the most popular fantasies for both men and women?
Hello, everyone, and welcome. I am Michelle Melville-Kashon. I am the Community and Content Director here at Sexual Health Alliance. I am so excited to introduce Dr. David Ley, a renowned clinical psychologist, author, and internationally recognized expert in the field of human sexuality. Today, we're diving into the fascinating world of group play and partner sharing, a topic that's both widely fantasized about and deeply misunderstood. Dr. Ley will be headlining our upcoming event, The Psychology of Group Play and Partner Sharing, and we're going to give you a sneak peek into what you can expect. So let's get into it. So, Dr. David Ley, welcome. Tell us a little bit about yourself.
Thanks for having me. Uh, you know, these are topics that I've always been interested in as a psychologist and sex therapist. I mean, kind of interested in them as a person too, but we don't have to talk about that. But when I was like so many therapists, I got almost no training on sexuality when I was in school. And what I did get training on was focused just on basically pathologization of sex. I got taught, how to diagnose sexual disorders and stuff. But I was never taught, that interest in sexual diversity is normal. I was never taught, that um, uh, Christian Joyal is a researcher in Canada. He's one of my favorite researchers, and he researches interest in paraphilias and sexual, fantasies and stuff like that. And he even has this one research study where he explores, what is an unusual sexual fantasy. And I was not taught any of that when I was in school. 50%, according to Joyal's research, 50% of people in a general population are interested in sexual behaviors that the DSM says are pathological. Interest in exhibitionism, interest in voyeurism, interest in sadism and masochism. And when I was learning those things, like most of us in grad school, when I was learning those things, I was taught how to diagnose them because those interests must be unhealthy. Turns out, not so much.
Right.
And I can remember one of my professors who I had a deep amount of respect for and still do. He's an incredibly talented and insightful clinician and psychologist. But I can remember him saying to me that women's interest in being in a gangbang was evidence of pre-morbid psychosis. And the argument was that interest in being in a gangbang was an early indication of a fragmenting psyche. That because the psychological, personhood was kind of falling apart, that the woman desired multiple men. And my professor was a Freudian, and Freud himself, I talk about this in the training, Freud himself had some strong ideas that interest in, group sex or, any kind of deviant sex was also evidence of, an immature and underdeveloped personality.
Wow.
I've been thinking about that a lot, particularly just over the past couple of weeks, because I don't know if you've seen all the news coverage of these two OnlyFans actresses, Bonnie Blue and Lily Allen, I think is the other one, and both of them have been doing these group experiences. One of
Yes.
them, I think had sex with 1,000 men over a 14 or 15-hour period. And they're doing it for these sensational reasons, but I'm watching the media just attack these women. And that was what stood out to me as I started wrestling with these issues as a psychologist. Is interest in groups inherently unhealthy? Is it a sign of psychological disturbance? Well, if it is, then why is interest in groups one of the most popular fantasies for both men and women? Why is groups a behavior that we can identify, throughout human history, including in multiple cultures where groups was not only a culturally sanctioned activity, but was part of religion and spiritual practices. If these things are so unhealthy, then why are people so interested in them? And I like doing this training because these are kind of fun topics, and but that we don't normally talk about in a serious way. But
Right.
I really do think I think it's important for therapists to think about these issues because most of their patients, whether they say it or not, are interested in,
Right.
or have been with multiple partners. And does that matter? Maybe, maybe not. Um, I want therapists and coaches and counselors and educators to be able to put, interest in partner sharing or group in a context that really helps to understand these things are normal. These things are human. When I wrote Insatiable Wives, kind of this, it's almost a parallel story that, I encountered these couples where the husbands shared the wives with other men and never having been exposed to these ideas before. My initial reaction as a psychologist was, that's fucking crazy. But luckily, the couples that I met that were into wife sharing were remarkably healthy. And it
Yeah.
forced me to go to question myself. Well, why did I think that was unhealthy? Oh, because I'd never heard it before.
Mhm.
And because I had unthinkingly allowed a lot of bias around female sexuality, around promiscuity, around non-monogamy to kind of sneak into my clinical thinking.
Yeah.
Um, and when I started diving into it again, I found, discussions of wife sharing back to, pre-biblical, times in Greece, back to, evidence of these kinds of behaviors throughout human history, evidence of couples, sharing their wives with other men, and it was perfectly healthy.
Yeah.
Places where it was culturally accepted. Um, and again, I was like, oh, maybe this stuff is normal human sexuality. And now, since I wrote that book, Insatiable Lives, the cuckolding has just exploded. I mean, it is all over the internet. And I'm one of the only people that has taken it seriously.
Hmm.
As well, others have since, but I was one of the first people to really take it seriously and say, there's something important here. There's something interesting here from a psychological and human perspective. Let's explore this because it says something to us about sexuality, about male sexuality, about female sexuality, and about marriage, that I think is just really interesting. And maybe that says something about me, just that, I find the unique, the secret interesting, but ultimately that's why most of us go into this field because
Yeah.
we are closet voyeurs and we want to hear about the fun things our patients are doing.
I was just thinking that. I'm like, a lot of people in our community think this is a fascinating topic. And like you had mentioned, it's so important to teach that this is not a problem and a diagnosis. Like it's, a lot of our students have probably been taught that in clinical programs, so I think this is just opening their eyes to a new perspective.
Yeah, one of the things in the training that we'll talk about is how people have encountered these issues with their therapist and doctors and the kind of shame and judgment that they get. With therapists assuming that their patients interest in this kind of means there's something wrong with them and that they have to stop,
Right.
or that it's going to destroy their marriage. Um, and that that's one of the things I get passionate about because as a therapist, I'm here to support my patients, not to be their moral judge. And unfortunately, I think a lot of people out there, are judging this and they think they're judging it based on, fact, but actually
Mm,
they're judging based on morality. So for instance,
right.
one of the things that I hear from lots of therapists is the idea that a woman who has lots of casual sex or group has low self-worth and that
Mm,
that her, sharing her body with these people that she's not in relationship with shows, how little she values herself.
yeah.
And A, that's an economic argument. That is saying your body has a price and you shouldn't put it out there for cheap. You shouldn't put it out there for free.
Yes.
And that's just gross. But B, there's not really good data to support this. There's, there are many women that I know who embrace casual and group sex, and they have incredibly high self-worth and high levels of self-confidence. And in fact, that's one of the things that, Jana, I think we'll talk about. Dr. Jana Vangelova, one of our guest speakers, and she's going to talk about that these experiences can be healthy when you go into it for the right reasons and when you go into it from a place of personal strength. So again, the idea that there are so many moral kind of values that get snuck in here. And I want people that are helping folks out there about sexuality to come from a place of evidence and facts, because that's how we avoid shaming our patients.
Yes. And this, what you just said reminds me of like the old, very cringy saying that I think a lot of people my age and older grew up with. Like, no one's going to want to buy the cow if you give away the milk for free. I
Mhm.
can't even tell you how many times like I heard that growing up, and that kind of stuff just sits in your mind, and everyone believes, ugh, don't have sex, don't explore sexuality unless you're married. That, makes you worthless. And that's just an awful, awful thing.
Mhm. Yeah, it teaches again, it teaches us to view sexuality as a commodity. It teaches us to view, it teaches men to view as something that they need to, purchase or trade for. It teaches women that they need to keep this resource close.
Mm.
Roy Baumeister and Jean Twenge wrote an article about the cultural suppression of female sexuality, and they talk about exactly this. They talk about that. Um, the most of the suppression of female sexuality comes from other women who are trying to suppress female sexuality in order to make men want to get married so that they can have and
Right.
and that's an antiquated notion. And it's just not the case anymore. Those I understand where that came from.
Mhm.
But now we can see, how much slut shaming is embedded, and that's actually one of the things that we talk about in both discussion of partner sharing and groups is that it is women who express these interests or who go along with them that consistently suffer social punishment and harm because of those interests. Men kind of get a pass. Roughly 70% of men will report a fantasy of having a threesome with two women.
Yeah.
And almost nobody judges men for having that fantasy.
No,
Well, of
that's
course, guys would be
common.
into it. Yeah, right.
Right. Yeah.
Duh. But if a woman expresses an interest in a threesome, then she's assumed to be a slut.
Hmm. Yeah. There's
And
something wrong with her.
yeah,
Yeah.
um, well, isn't one man good enough for you?
Right.
And then in partner sharing, historically, sharing one's wife with other men was mostly introduced by men.
Hmm.
Um, Women who expressed an interest in it would be punished. In recent years, that shifted, and I'm seeing and hearing more women now identifying, yeah, this is something I'm into. This is something I want, something I went to my partner and said I wanted to explore. But historically, if a woman got caught being sexual with a man other than her husband, women faced, social consequences such as banishment, murder, being put out on the street, ending up in a homeless shelter, unable to support their kids. Um, Women experience really significant punishments. Again, all of that is shifting um, in more egalitarian ways.
Hmm.
And I think it's time for us to look at these values and beliefs around, group play and partner sharing to see, do we still believe these? Are they still right? And if not, what do we do about it? Um, it's been one of the interesting things across my career is that the internet has led to people now finding out they're not the only ones with these interests. And that normalizes, it destigmatizes, it increases their self-acceptance. Um, and ultimately, I think that's a healthy and positive thing. It's one I want to, again, it's why I love doing this training because we get to take, these salacious topics and explore them in a serious and fun way.
Right.
Yeah.
And so you had mentioned, so this is a little bit of a fun question. So you had mentioned that this is a common fantasy and practice across cultures and identities. So why do you think that is? Why do you think people are into partner sharing in groups? And I'm sure this is a longer answer that we're going to talk about at the event, but if you just had to give like a highlight reel.
Why wouldn't they be?
I love that. Why wouldn't they be?
Yeah, I mean, we ask why are they? Well, why wouldn't they be? These for people that are into sexual adventure, for people that are into sexual excitement, for people that are into exploring sexual taboo. These are the things that make them hot. In a society that idealizes monogamy. of course, people are going to be turned on by the idea of doing what they're not supposed to do.
Yes.
You should be happy with one person for the rest of your life. And if you're not, there's something wrong with you. And of course, lots of people are going to go, oh, of course. And then furiously masturbate to the idea of being with other people. Oh,
Right.
yeah. If they didn't want us to find these things so sexually arousing, they shouldn't tell us that we shouldn't do it.
True, true. All right, so we like to leave our audience with one valuable takeaway or tip. So if you had to leave our audience with something related to group play or partner sharing that you think they should know, what would that be?
You know, the easy thing, don't assume that there's something wrong with them. The more sophisticated thing is to say that interest may or may not tell you anything about that person.
Yeah.
And if you're in a professional situation with them, don't have sex with them, no matter how arousing you find that fantasy too.
Yes, excellent. And I know we did a huge event on ethics. I mean, that's like ethics 101 right there. But still,
And yet it happens. I mean, there's all this, hotness right now and hype around, psychedelic assisted
mm,
therapies. And one of the scandals is that there's a male psychiatrist and his wife, I think a psychologist, who were doing MDMA assisted psychotherapy and ended up having a threesome with the female patient.
mm,
So, we can understand how that happens, but we also need to understand the things we have to do to manage ourselves to make sure that doesn't happen. Um, and I'd kind of love to know, had that couple, ever had threesomes before? Was it something they'd talked about and had a fantasy about and never found anybody that was interested in? They should have, if so, boy, that's something they should have negotiated and thought about before walking into a situation with a vulnerable and sexually aroused person under the influence of MDMA. But that here I am pathologizing a bit, but it's not the group sex that's the pathology there.
right,
It's the violations.
right. It's the ethics concerns.
That's right.
Well, thank you so much for being with us today. For anyone who is fascinated by this topic and wants to learn more, please check out our event, The Psychology of Group Play and Partner Sharing, happening May 17th and 18th. This is an online event, very accessible. It's open to the entire community. Some of the people who will be at this event are therapists, educators, counselors, coaches, medical professionals. This event is open to the public. So if this is a topic that you're passionate about, that you want to learn more about, we encourage you to check it out, and we'll have the link in the description below.
Yep, we pretty commonly have people that are, sexual enthusiasts who are into cuckolding and cuck queening themselves, who come just because they want to hear the facts.
Right, exactly. And we're going to have so many amazing guest presenters that are going to be there. We're going to have a panel from the Cuck My Life podcast. So it's going to be really an interesting, like you said, David, it's going to be a fun and informational event all wrapped into one.
And that is going to be unique. This is the first time that we've had a panel of the men who are or want to be cuckolds speaking. And I think that's going to be really important because one of the things I hear from therapists and coaches all over the world is that they are seeing men who just desperately want their wives to cuckold them, and the therapist and coaches don't know how to help these guys. That's one of the things we're going to be talking about. How for those guys, where the wife might be interested, how do you do it safely? For those guys where the wife is just absolutely not interested, how does the guy manage those desires and interest and maintain a healthy relationship?
Yeah. And I think this is going to be one of those events where people walk away with so many practical skills that they can use no matter which area of sexual health they're in. You're going to have practical skills. You're going to have a great time. You're going to learn lots of really fun information. So I would definitely encourage you to check it out if you're interested.
And I do.
Yeah, same here. All right. So, for anybody who loves this type of content, please like this video and subscribe to our channel. And thank you again, Dr. David Lay.
We will see you guys in a few weeks.
Sounds great. Bye, everyone.
Bye.
Hello, everyone, and thank you for watching our video. We just had a fabulous conversation with Dr. David Lay, and he was telling us what he'll be talking about at our online event, The Psychology of Group Play and Partner Sharing. So we talked about why fantasies about group sex and partner sharing are so common across cultures and identities. We talked about some of the misconceptions that people see as mental health professionals and in the public about group sex and partner sharing. And then Dr. David Lay left us with a great takeaway for our audience. So we hope you'll enjoy this video. Thanks for watching. Bye.